Designer drugs, advanced diagnostics, alternative therapies, all weapons in the warfare being waged on the front line of American healthcare. And researchers are persistent in their pursuit of new ways to arm the medical arsenal.
Diabetes. It's an undertreated and often undiagnosed disease that has reached epidemic proportions in the U.S., affecting roughly 1 out of every 10 people over the age of 20, and growing at an alarming rate among children. Due in large part to the parallel epidemic of childhood obesity and carbohydrate-saturated diets, there's now more than 150,000 children dealing with this relentless disease, and it's estimated that as many as 10 million adults have diabetes and are not even aware of it. And among the roughly 24 million with known diabetes, fear of insulin injections and unfamiliarity with other methods of blood sugar control is responsible for many people being undertreated, leading to potentially devastating long-term consequences.
Complications of diabetes can fall into 2 categories: acute complications and chronic complications. Acute complications, hypoglycemia and hyperglycemia, occur because of an imbalance between food, exercise, and medication. For chronic complications, eye problems, kidney problems, cardiovascular problems, nerve damage are caused by long-term exposure to high blood glucose levels. They can occur years after a person is diagnosed.
The ability to control and manage diabetes greatly reduces the likelihood of these serious complications. However, according to Dr. Michael Silver, Vice President of Medical Affairs at Rush Oak Park Hospital in Oak Park, Illinois, the method of treatment and management that is most effective for one person might not be as beneficial for the next.
We've observed dramatic responses when we customize our approach to what the patient actually wants. That's not to say we're not focusing on blood sugars or blood pressure or their lipids or their weight, but instead we're aware of those, but we really try and deliver the message to the patient that they're ready to accept. And whether it's through a dietitian or a nurse or an educator or a physician, everybody comes together, identifies the patient's needs, and delivers what that patient's ready to learn. And it makes a huge difference with compliance. Patients get better, they stay well when you're able to connect with them on a one-on-one basis.
In general, once a person is diagnosed with diabetes, it's only after they have lived with and followed their prescribed individual management plans over time and experienced the effects on their body and blood sugars that they know whether or not the prescribed plan actually works. In a comprehensive treatment approach to diabetic care, the patient is at the center of a multidisciplinary team, working together with them and their primary care physicians to discover what treatment plan works best for them from the beginning. With the patient in charge, the team at Rush Oak Park Hospital's Center for Diabetes and Endocrine Care empowers the individual with a custom-tailored treatment plan and information, enabling them to control diabetes at home and on their own so they can maintain a high quality of life without the guesswork and confusion that some people can experience when first learning they're diabetic.
We teach patients with diabetes that they take care of their disease. We have a comprehensive approach using nutritionists, educators, and doctors to have them understand the pathophysiology, the treatment, the complications. An educated patient is going to be able to take control of their disease and live without the complications of diabetes down the road.
They analyze in all aspects of your diabetes and develop a treatment plan that's suited to you, the individual patient, and take it from there. I eat light and right, I exercise regularly. I feel healthy, and I'm confident that the people that are treating me know what they're doing, and they help me to get the maximum benefit from my treatment plan.
To learn more about Rush Oak Park Hospital and the CDEC, contact them at 708-660-INFO or visit them online at www.roph.org.